Good evening, my name is Robert Gauthier, President and co-founder of Nutraxis International. Some of our customers wrote to us with questions. Tonight, we're going to answer these questions as the first segment of a weekly Viprox news link. The first questions our viewers are asking is, can everyone consume Viprox? As a general rule of thumb, most everyone can use Viprox as a therapy. But being that it has three distinct components, we have some restriction. When it comes to Viprox as the first component and the baseline for the use of our product, there are two counterindications. The very first one is if a person has milk protein allergy, they definitely have to be cautious on the use of this product. And the other counterindication is if a person has had an organ transplant and they are on an immunosuppressive drug, then obviously the treating physician wants the immune system to be downregulated, and the general perception is that we upregulate the immune system, whereas in fact we balance the immune system. So the person should tell their physician if they are on an immunosuppressive drug. Besides that, there are no counterindication in the use of this product. The second component in Viprox is called triosime. It is a sprouted grain complex, and obviously in this case people who have celiac disease are gluten sensitive. The product is just below the detectable levels of gluten, but I would say that a patient should be cautious if they have celiac disease. The third component of our Viprox package is Une Vie, a super hydrating formula. It is used as a delivery system. So yes, most everybody should be on Viprox. I have a question here from our lectors saying, if it's so good, how come doctors are not prescribing Viprox? As a matter of fact, doctors are prescribing Viprox, but we're a new company, and yes, the word hasn't gotten out there, but with your help and all of you consuming the product, if you get your doctors to know about it, obviously a lot more patients will benefit from them prescribing it. As we've addressed originally, this is a therapy that works on the cellular level. We're not addressing diseases per se. We're taking care of cellular health, and more doctors are going to get in and understand the value of Viprox. I have AIDS, and presently the virus is stable. If I take Viprox, will I cure from this disease? Clinical studies in Africa showed that the patients regained their energy, their CD counts were regulated, they had better eating habits, the assimilation of their foods was done a lot better, their viral load in subsequent studies clearly went down to undetectable level. We cannot say that we're the cure for AIDS, but we're a very good treatment which will give you a quality of life, and you will have a sustained quality of life till you die of old age. Okay, we have a question here. It says, I'm on chemotherapy. Is that going to destroy the GSH in my blood? Well, first of all, we have hospitals whose patients are on chemotherapy, and what we have discovered is that most patients will recuperate a lot faster from their chemotherapy. Now, depending on the gravity of the chemotherapy, they will not lose their hair and they will not be sick every morning. So it's not a question of will the chemotherapy hinder the GSH. It's more a question that GSH complex will clean the cells from the toxic effect of the chemotherapy, and thereby giving it a better effect, and they will recuperate much faster. This is all for tonight, folks, but please feel free to ask any question, and I will personally take the time to answer you on this weekly segment called Viprox News Link.